Hello and welcome to this Healthy Smile Happy Child presentation on commonly asked questions about dental care for moms and babies. We will start off by talking about dental care during pregnancy. This is a question that we often get from moms at the dental office. Since becoming pregnant, I've noticed that my gums are red, puffy, and bleed when I brush and floss. Why is this happening? This is happening because pregnant women are more likely to get gum disease or bleeding gums because of the hormones that are released during pregnancy. So, what can we do in order to prevent this from happening? One of the best things that we can do to prevent gum disease is to establish a good oral hygiene routine. Brushing your teeth twice a day for 2 minutes using a soft toothbrush and fluoride toothpaste is very important. Making sure that you're brushing all surfaces of your teeth, the front, the sides, the back, and chewing surfaces, as well as flossing at least once a day. Going to the dental office regularly is also a good way to prevent gum disease. Scheduling a dental checkup at the beginning of pregnancy to get your teeth cleaned and your health check is very important. Making sure that you talk to your dentist or dental hygienist if you have any questions is also a good way to learn more about how to prevent gum disease. This next question is another one that moms often have when coming to the dental office. Now that I'm pregnant, is it true I'll lose calcium from my teeth, making them more weak and more easily decayed? Now, this is not true, but let's start off by talking about what is calcium. Calcium is a mineral in our bodies that helps build teeth and bones and helps keep them strong and healthy. It can be found usually in dairy products like milk, cheese, yogurt, and nuts as well. If you're not getting enough calcium in your diet, your body will actually take it from other parts of your body first, like your bones. Teeth are the very last place calcium will be taken from. It is also not true that you can expect to lose a tooth for every child you have. The reason for loose teeth is actually untreated gum disease. If you have any concerns, please do not hesitate to talk to your dentist or dental hygienist. Now let's talk about dental treatment during pregnancy. A lot of moms are usually worried that going to the dentist while pregnant is not safe for the baby. Now, receiving dental treatment during pregnancy is actually safe. And preventive treatment like cleanings can be done at any time during the pregnancy and will help you keep your mouth healthy and help prevent oral diseases like gum disease. For other dental treatments like fillings, it's best to wait until the second trimester. If x-rays are needed, the dental staff will give you a lead apron and collar to protect you and the baby from radiation. If you have any concerns, please ask your dentist or dental hygienist during your appointment. Now let's talk about morning sickness and oral health. The question is, what should I do to protect my teeth if I have morning sickness? Most people usually reach for the toothbrush and toothpaste after being sick. We, however, recommend that you wait at least 30 minutes before brushing your teeth. This is because morning sickness can expose your teeth to stomach acid. This can in turn weaken the surface of your teeth and put you at higher risk for tooth decay. If you're brushing immediately after being sick, you're spreading that acid around on your teeth, and that's something that we want to avoid. We recommend that you rinse your mouth with water or a fluoride mouthwash immediately after being sick to prevent this from happening. The next question is about prenatal nutrition. To best protect an unborn child's teeth, in what trimester should the pregnant woman start paying attention to her diet? Now, it's important for moms to start paying attention to their diet from the very beginning of pregnancy, because baby teeth actually begin to form at 6 weeks of pregnancy. Teeth actually have the best chance of developing well if the mom takes prenatal vitamins and follows the recommendations of their healthcare provider from the very start of pregnancy. Eating a well-balanced diet is really important, and it's important for this diet to include calcium-rich foods like milk, cheese, yogurt, and almonds, as well as foods high in vitamin D, like milk, salmon, and eggs. It has been shown that children of moms with low vitamin D intake in particular are at higher risk of developing tooth decay. So it's important that the mom continues to include vitamin D rich foods as well as calcium rich food in her diet. The next question is about smoking during pregnancy. What can happen if I smoke when I'm pregnant? Now, smoking can affect your and your baby's overall well-being and dental health. A lot of people don't usually connect smoking with the development of baby teeth, but there have been studies done that show a link between smoking during pregnancy and children having increased risk of tooth decay, as well as children having an increased risk of having dental surgery later on. If you need help quitting, please talk to your doctor, dentist, or dental hygienist for resources. Let's now talk about dental care for infants, toddlers, and preschool children. Let's start off by talking about some facts about tooth decay. Did you know that tooth decay is actually more common than asthma, and more than half of the children in our community show signs of tooth decay? Also, about 3 out of 10 child surgeries in Canada are dental surgeries that are done to remove or restore decayed teeth. Decayed teeth have a huge impact and effect on our baby's health. It can lead to a loss of sleep, pain, difficulty eating, difficulty speaking, emotional distress, and decreased self-esteem, as well as extraction and loss of teeth. It can affect how the adult teeth come out, and it can also lead to oral infections or abscesses and infections in other parts of our body as well. This is why it's so important to start taking care of our baby's teeth as soon as they come in. Let's take a look at the stages of tooth decay. Starting on the upper left, we can see a picture of a healthy teeth, which are white and shiny. On the upper right, we can see some white lines by the gum line starting to form. When these chalky white lines appear, it's a sign that there is tooth decay starting. These chalky white lines often first appear on the upper front teeth right along the gum line. By having a good oral hygiene routine, brushing or wiping the teeth at least twice a day, and using toothpaste with fluoride, we can stop these white lines from becoming cavities. If nothing is done after the white lines appear, they can worsen and become brown spots and cavities, as you can see on the lower left. At this stage, it's important that you take your children to the dental office as soon as you are able. If nothing is done at this point, cavities can worsen even more and can lead to black, broken teeth, which can cause children a lot of discomfort and pain. At this stage, a lot of the children will usually need dental surgery to remove or fix their teeth. So it's very important that we take action as soon as those chalky white lines appear. We can actually check for tooth decay at home by lifting our children's lip once a month to check for any signs of tooth decay, like those chalky white lines along the gum line. If you would like to learn more about how to check for tooth decay at home, check out our Lift the Lip video in our Healthy Smile Happy Child YouTube channel. So let's take a look at the things that we can do to make sure that this doesn't happen to our baby's teeth. In order to help our children avoid getting tooth decay at an early age, it's important that we start caring for baby teeth even before they come in. So how do we do this, and why is it a good idea to clean our baby's mouth before their teeth come in? We should be wiping our baby's gums with a wet, clean cloth after feeding to remove sugars from the mouth. This can lower the risk of children getting tooth decay soon after the eruption of their first baby teeth. It also helps develop good lifelong oral health habits. The earlier you start, the easier it will be, and it will also get your baby used to having you poking around in their mouth. There are different ways you can use a cloth to wipe your baby's gums. Always wrap the wet, clean cloth tightly around your pointer finger. You can hold your baby in one arm and use the hand with the cloth to wipe their gums. Another way to do this is to lay your baby on your knees. This will make it easier for you to see into their mouth and clean their gums as they look up at you. The next question is about teething. When will my baby's first tooth come in? Babies usually start teething around the ages of 6 to 10 months. No two babies are the same, so some may teeth before the 6 months and some may teeth after. However, if your baby still does not have any teeth by 12 months of age or a little bit later, please consult your dentist. The first teeth to come in are usually the lower front teeth, and these are closely followed by the upper central teeth. Some of the common symptoms that we can see when our children are teething are fuzziness or irritability, trouble sleeping, loss of appetite, so they might not be eating as much as usual, drooling more than usual, facial rash, which is usually caused by the excessive drooling, increased biting, and a mild temperature elevation or fever. A high fever, however, is not a normal symptom of teething, so if your baby has a high fever, please consult a doctor right away. So how can we safely help our babies through the teething period? Here are some tips on how to soothe a teething baby. Give your child a clean, wet, cool cloth to suck on. Gently rub their gums with a clean finger or moist cloth. Give your child a cold teething ring, looking for ones that are made of solid rubber. Here's what to avoid. Liquid-filled teething rings or plastic objects that could easily break. Teething biscuits because they're full of sugars. If teething biscuits work for you and your child, just make sure that you're wiping their gums or brushing their teeth after you give them the teething biscuits. Amber necklaces because they can be a choking hazard, as well as numbing gels that are sold over the counter. Let's talk about baby's first dental visit. The question is, when should my child first visit the dentist? We always tell parents to celebrate their baby's first birthday with a visit to the dental office. Bring your child for a dental checkup within 6 months after the first tooth appears or by 1 year of age. The earlier the first dental visit, the better the chance of preventing dental problems. We also want our children to get used to going to the dental office from an early age and to get used to having a stranger looking around in their mouth. Some offices in Manitoba also offer a free first visit, so it's always a good idea to ask if they participate in the free first visit program. Our next topic is about infant feeding, and the question is, what do I need to know about breastfeeding? Well, breastfeeding is actually really good for your baby. It's natural and protected. It lowers the risk of tooth decay. However, if you're breastfeeding for longer than 12 months, without having a good oral hygiene routine established, like brushing twice a day or wiping their gums after feeding, this can increase the risk of tooth decay. Always remember to wipe your baby's mouth with a clean, wet cloth after each feeding. The next question is, if my child uses a bottle, what do I need to know? The main thing we tell parents is to limit bottles to feeding times only. Avoid giving your child a bottle between meals or to go to bed with. One of the main causes of children getting tooth decay is going to sleep with a bottle with something other than water, like milk, which contains sugar. The sugar in the milk is eaten by the bacteria in your child's mouth, which in turn makes acid. This increases your child's risk of getting tooth decay, as the acid stays in the baby's mouth and teeth for the whole time that they're sleeping. If your baby needs to go to bed with a bottle, make sure that you're filling the bottle with watered down milk or water. Try not to fill your baby's bottle with juice, pop, or other sugary drinks when they go to bed or even during the day if they use the bottle to snack with. Start weaning your baby off the bottle at around 12 months of age. If your child falls asleep with a bottle of milk every night, here's a helpful tip on how to slowly water down the milk to help decrease the risk of getting tooth decay. The trick is to slowly introduce water into the bottle and increase the amount of water slightly each week for a period of 4 to 6 weeks. By weeks 4 to 6, the bottle should contain only water. At this point, children will either continue to take the bottle with water or avoid the bottle entirely. If you would like a copy of this poster, you can find it by going to our Healthy Smile Happy Child website. The next question is about sippy cups. Are they okay for our children to use? We recommend that you switch to a sippy cup or lidless cup by the time that they are 14 to 18 months old at the latest. Use a sippy cup only for milk or water. Avoid filling the sippy cup with juice, pop, or any other sugary drinks. Sippy cups should only be used as a transition from the bottle to an open or regular cup. Let's talk about healthy snacks for healthy teeth. Avoid giving your child sugary snacks and drinks between meals, as this can increase the risk for tooth decay. Stick to snacks like nuts, which are crunchy, can clean our teeth and stimulate our saliva flow, fruits and veggies, a lot of which contain healthy, natural sugars, and cheese. Cheese is actually great for teeth. It cleans our teeth, stimulates saliva, and gets rid of the plaque that's on our teeth. It's rich in calcium, which can strengthen our teeth, and it also lowers the acid levels in your mouth, which protects from tooth decay. It's always important to be aware of how much sugar the drinks that we give our children can sometimes have. This poster here shows you how many sugar cubes some popular drinks have. First we have powdered drink mixes with 13 sugar cubes in 1 cup. Next, unsweetened apple juice and pop. Both have 12 sugar cubes. This is often shocking to most people, the fact that apple juice can have as much sugar as pop. Unsweetened juice is a more nutritious choice, but for teeth, juice is actually no better than pop. If you give your child juice, limit to half a cup per day and always make sure that you brush your teeth at least twice a day or after each meal. Now let's talk about thumbs and soothers. The question is, what do I need to know about pacifiers and thumb sucking? Now, sucking on thumbs, fingers, and soothers can actually make babies feel secure and happy. We recommend that soother introductions should wait until breastfeeding is firmly established if you choose to breastfeed. If you choose to introduce a soother as well, make sure that you choose one that is a one-piece. In order to keep your child's teeth healthy, try not to dip the soother in any sugar or sugary liquids, like honey. Also, avoid cleaning the soother with your mouth, as this can transfer cavity-causing bacteria to your child. We always recommend that you try to stop thumb and soother use by the age of 3, because continued thumb sucking or the use of a soother past the ages of 3 or 4 can actually start to create crowded, crooked teeth or bite problems for your child. Let's now talk about mouth care. The first question here is, when should I start brushing my child's teeth? We recommend that you start brushing as soon as the first tooth comes in, especially along the gum line. Teeth are actually less resistant to tooth decay when they first come in, so it's really important that you're using a fluoride toothpaste when you're brushing their teeth. The second question is, how much toothpaste should I use when brushing my child's teeth? When you're brushing 2 times a day for 2 minutes, make sure that you're using a fluoridated toothpaste. And why? Why should we use a toothpaste that contains fluoride? Because fluoride makes their teeth strong, it helps fight tooth decay, it also strengthens the already weak areas of the teeth, and it costs actually less than fluoride-free toothpaste. It also kills the bacteria that can cause cavities. So when you're brushing at nighttime, it's really important that you get all the areas of the teeth. For toothpaste amounts, make sure that you use only a smear or grain of rice size for children who are age 0 to 3. After 3 years of age, make sure that you're using only a green pea size of toothpaste. This goes the same for adults. You don't need any more than a green pea size. Parents and caregivers should put the toothpaste on the toothbrush always and teach their children how to spit it out. The amount of toothpaste that we recommend here are so little that even if the children swallow a little bit, it won't cause any problems. The next question is, when will a child be able to brush on his or her own? Now, we encourage parents to continue to help their children with brushing and flossing until they are 8 years old, as this is the age when they have proper motor skills to do a thorough job. This is important because we need to make sure that our children's teeth are getting brushed properly and all areas of the mouth are getting cleaned. If your child wants to brush on their own at an early age, do not discourage them, but make sure that after they brush on their own, that you go through their teeth with the toothbrush again to make sure that all areas have been brushed. Now, what about flossing? We tell parents that when teeth start touching, it's time to start flossing. A common question we often get, however, is, if I brush really well, is it okay if I don't floss? The answer is no. Flossing is important because toothbrushing only removes half of the plaque and food that's on our teeth. Flossing removes plaque and food that's between the teeth and between spaces between the teeth and the gums. Not flossing regularly might result in gum disease. Thank you for listening to this Healthy Smile Happy Child presentation. For more information on how to take care of baby teeth, you can follow us on Instagram, like us on Facebook, take a look at our other videos on our YouTube channel, and check out our website. If you have any questions, you can contact us at hshcinfo@crem.ca.